most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course,
Today,
Bob.
we're going to show you how to stop knee pain with 7 at-home exercises, includes strengthening.
Right.
This is good because a lot of you can't get out to your therapist yet. So
Right.
we're trying to include a lot of home exercise videos so you can try some things on your own.
Exactly. And Bob, are we going to continue on? Or
Yeah, let's continue on.
Okay, go ahead.
Oh, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, if you get a chance, go to bobandbrad.com. This week, we're giving away a knee glide, which actually kind of fits along with this.
It does,
You want to show the knee glide real quick?
Yes, I do.
You can also find it on Facebook, the contest that is. It'll be pinned to the top of the page. Go to Twitter or Instagram or TikTok if you want a 60-second version of our program. Here's the knee glide. Great after surgery, especially after a knee replacement. I think it's almost vital after those, Brad.
Good for those arthritic knees as well. Anyways,
even anybody can lift it. Great grandma could lift it, I think, with her fingers.
You bet. 3.1 pounds. All right. So, Bob, I got to be honest with you. This is excellent for anybody, any age. But actually, the person, someone I know, she's in college.
Sure.
Young, and she's complaining of knee pain, and she's concerned about strengthening her legs to help her knees. I thought, I can help you out.
Yeah,
we'll make a video for you. You're not the only one in your situation.
Is she going to say her name?
Allie.
Allie.
Yes.
She's at Ace Hardware?
Yep, and she's working there, working her way through college. You know the routine.
So I thought it was funny. Brad wrote Allie at Ace, and so I thought it was Alice. I put the two together.
Right.
Allie at Ace.
Let's get on with the program.
Let's go.
First thing with your knees, if you're having pain with your knees, and in her case, it's with weight bearing, and she says they kind of feel like they lock up or they're painful. We need to make sure that your knee has full range of motion in both ways. In other words, does it go fully straight, and does it flex or bend all the way? Typically, if you have knee pain and one side's more painful or just one side's painful, oftentimes that knee will not have full range of motion in one way or another. If it's with walking, it's almost always with getting fully straight. So we want to check that out. I'm going to actually use the ball here. You don't have to do it. You could use a stool or
another chair.
Yep, another chair. But look at here, and does the knee go all the way straight? Now, what you'll want to do is compare to the other knee. Now, if this one you can see goes all the way down, and you can feel it's down at the end range, we call that, and this one goes down, and it doesn't quite make it, and there may be a little pain associated with that pushing. We want to get that straight, so we're not going to force it straight all at once. I guess that could happen, but typically
you're going to have probably a lower stool than this, Brad, because your hamstrings might pull too much.
Yeah, this is too tall.
So
we there it is, right behind you, Mike.
I can go get it.
Yep. Well, you can do it on the floor as well, Bob. You're in the camera way.
That's
there.
all right. I want a camera time.
I'm going to push down like this. Pressure on, pressure off, just till you bump into that pain a little bit, and do that 10 repetitions. Don't get too aggressive. Be nice to it.
Once again, we show how organized we are.
Yeah, exactly.
This is would be more appropriate. Now your hamstrings aren't going to be as tight.
Yeah, that's a good point.
Be able to straighten the knee.
Yeah, we don't want it too high. And do 10 repetitions. You can do that 2 or 3 times a day.
Sure.
Within a couple of days, you should notice some improvement. It's possible that your knee it won't straighten because of other problems, but you got to give it a try, and usually you'll get straighter. And as you get straighter, the knee pain will oftentimes go down along with it.
Well, if it's not straightening, or it is completely straightening, then it might be that it's not bending as well.
Right. Yep. So then you're going to
work on bending.
Yep. So go pull up here and see. Now, someone is, in their 20s, like Allie, a healthy person, usually can get all the way back to their heel. It's pretty close to their buttocks there. But again, compare one to the other. If there's pain when you get up here and it kind of locks up there and there's a distance here, then again, you could use a stool. You could go without it, but we're going to actually do the repetition where you bend and relax. Pressure on, pressure off.
Even had people just stand on, put on a chair like this.
Go
and
ahead,
stand
Bob.
Like this and whoa, this chair is slippery.
Yeah, don't
Lean
use one of
forward.
these cheap
Yeah, don't use
patio
one of these chairs,
chairs.
but you can get a little stretch like this going too.
Actually works really good into a stairwell where you can hold on to the rails. The other thing that you can do, you're doing the pressure on, pressure off. What are you looking for,
I'm looking
Bob?
for a towel.
That's right. It was right here.
Yeah.
Boy, we are really on the
Just
ball.
keep talking, Brad. Keep talking.
Okay, so the idea is to get it fully bent. And when you get it fully bent, and that again may take a few days doing that 2 or 3 times a day, you might luck out and it'll get straight sooner than that. But then you're good to go. If, by the way, you have full extension or full flexion right
One
away.
more flexion. You
All
can put a
right.
towel underneath like this and gap it like this. This really works well, Brad,
Yeah.
for people who are having problems.
Yeah.
Just stick a towel on there and it gaps the knee a little bit and helps with flexion.
Sure.
Sorry.
If you have full range of motion, 1 and 2, we just showed you don't even have to do any
Don't
of
even
those.
need to do
just
them.
skip all that last 2 or 3 minutes of babble.
Yeah. And we'll go to long arc quads.
Right. So now we're going to do some range of motion and some early strengthening. So just out like that, fully straight, hold it for a second or two, and then down. We don't want to do this.
Yeah, nice and controlled. And the thing is, you should do this throughout the day. Whenever you're seated, do a
Yep.
couple, rip off a good set of 10 of them.
Right.
Because that's how you're going to get stronger, and that's how you're going to help that knee from not locking
Right.
anymore, is to get some smoothness in that joint.
If you feel like this is just way too easy, don't worry. We got some harder exercises coming. Make sure you do both legs. The next one, that did the hamstrings. Now we want to get that did the quadriceps, I'm sorry. Now we want to do the hamstrings. This is an introductory level for hamstring strengthening if you don't have any equipment, weightlifting equipment. We're going to show a little advanced exercise in just a minute or two using the ball, which works really well for at home. But if you do are we clear, Mike? We do a bridge. Right now, I'm working the hamstrings just a little bit. So you may do that. We're working the glutes as well. People will be saying, oh, you're doing more than the hamstrings. But if we bring my heels away from my buttocks about to there, now you can feel those hamstrings kick in.
Yeah, you got to be careful. You could actually cramp them up a
Yeah.
little bit when you do
Yeah.
them this way. I often will feel cramping when I go that direction.
Exactly. And I can feel my hamstrings working. If by chance you do get a cramp doing this, simply straighten your knees out the best you can and then sit up, and that will release the cramp. And then give it a break. Come back the next day and do some more because we don't want to cramp. Now, this is the only thing is you do need, this is the best way that I know of to strengthen your hamstrings, particularly for higher level people, younger people like Allie, is you need a ball. Which, they're not a big expense, which is a nice thing. They're $15, $20.
Yeah,
You can get them
exactly.
online. So what I'm going to do is laying down like this, simply go up into that bridge position, and I'm going to simply roll the ball towards me. I'm going to do 10 of those. That is a lot. I would say not all, but mostly hamstring activity right now. And do 10 of those. If it's way too easy and it's like, that's not very hard, simply cross one leg. Now we're emphasizing the right leg. Definitely harder. You can definitely tell. But then you have to cross over and do the other leg so that you balance out. If that's too easy, you can do 10 on each side. And it's like, oh, that's too easy. I guarantee you, when you go to one leg like this, as you can tell by my voice, I'm straining.
Now you're maximizing.
Yeah.
You're going the full level here.
Wow. That's for the athlete.
Right.
So the ranges here, you'll definitely get your strengthening. So that's the hamstring strengthening aspect. Now we want to do quadriceps.
Sure. Gotcha, Brad.
All right. Now, the nice thing about quads is you can really strengthen them well without the ball or with the ball. We're going to show you both.
So we're going to do some lunges, Brad, to start off
Yeah,
with.
you can use a chair to hold on if you need balance. I'm going to use the booyah stick because I'm fond of it. I'm going to show it from this angle. We're going to step out like this. Plus, I can use a stick for showing mechanics.
Yeah.
And I'm going to go down to here. I'm not going to let my knee go past this vertical line above my toe shown by the booyah stick.
Yeah, look how he's going to dip down, basically.
They are like this. Now you can just go like this and do 5 to 10 of these, and you will feel quadriceps working big time. You know, get deeper if you want to increase it, or you can do what I call stepping motion here, and then alternate left and right. Either way, whatever works, trips your trigger. You can do both. Do one and then do the other day just to break it up. 10 of them is usually good. If you can't get to 10, start out with 3 or 5, whatever you can get to. Now, the thing about the balls for the quadriceps is it's easier to modify the resistance, I think.
That, and I think it's easier to keep your knees out of trouble. Like you can stop your knees from going past the toes a lot easier.
Right.
I mean, because you can lean back against it. Like when I do a squat like this, see how my knee is starting to go past my toes already?
Yep.
So I have to stay way back in order not to do that.
Yeah.
The ball lets you do that.
And then I'm going to work on my posture, simply squat down. Now, you're not going to squat all the way down like this. That puts a lot of stress on your knees. We're going to go down till your hips are even with your knees. Your thighs are parallel.
Well, to start, you might even do less than that. If you're having knee pain, you would actually just do shallow squats.
You may start out simple.
Just like that.
And then work your way down. Again, we're shooting for 10 repetitions. As you get stronger, if you're more athletic and you want more of a resistance, you can cross over like this and do them. That works my right leg. And then we're going to cross this way. And if you want to go, to the advanced level, the one-legged squat. Give me that stick.
Now you're working.
Yeah. So I'm going to use a stick to help me balance as well as a little assistance to get me up and back. So that's a nice advanced way. By that time, your knee pain's probably gone and you're really working towards that
so now
advanced strength.
Between those two, the hamstring and the quad, you're getting the major muscle groups that cross the knee.
Exactly.
And it'll help stabilize the knee.
There you go.
So
this is quite a range. We're going from range of motion to early strengthening to advanced strengthening. But it's all for Allie, and we want to be complete.
Allie.
Okay.
All right.
Enough
of that. Thanks for watching.